Juggling dental health with your work and family commitments can present a challenge for some, but with the new year, it's definitely worth doing an audit on your dental health habits. Brushing and flossing twice daily, and getting a professional dental cleaning twice a year are the best ways to keep healthy. But do you wonder what else you could be doing? There are a lot of lessons learned from oral hygiene tips given to our patients using Invisalign that anyone can make use of for healthy teeth and gums. In today's video, we will be showing you dental healthcare tips for healthy mouth. Without further ado, let's begin. Brush regularly but not aggressively. Brushing twice a day and using dental floss can help keep teeth and gums healthy. Most people are aware that brushing their teeth twice a day is one of the most important practices for removing plaque and bacteria and keeping teeth clean. However, brushing may only be effective if people use the correct technique. People should brush using small circular motions, taking care to brush the front, back, and top of every tooth. This process takes between 2 and 3 minutes. People should avoid sawing back and forth motions. Brushing too hard or using a hard bristled toothbrush can damage tooth enamel and the gums. The effects of this may include tooth sensitivity, permanent damage to the protective enamel on the teeth, and gum erosion. The American Dental Association (ADA) recommend using a toothbrush that has soft bristles. They also state that people should change their toothbrush every 3 months or when the ends start to look frayed, whichever comes first. Use fluoride. Fluoride comes from an element in the Earth's soil called fluorine. Many experts believe that fluoride helps prevent cavities, and it is a common ingredient in toothpaste and mouthwash. However, some dental products do not contain fluoride, and some people do not use it at all. Evidence suggests that a lack of fluoride can lead to tooth decay, even if a person takes care of their teeth otherwise. A recent review found that brushing and flossing do not prevent trusted source a person from getting cavities if they do not use fluoride. Many communities in the United States have added fluoride to their water supply. Several organizations recommend this practice trusted source, including the World Health Organization, the Centers for Disease Control and Prevention, and the ADA. People can find out whether the water in their area contains fluoride by contacting their local government. Reverse osmosis water filters remove fluoride, and people who use well water will need to check the fluoride levels in this water to find out how much is present. Many bottled water brands do not contain fluoride. Floss once a day. Flossing can remove plaque and bacteria from between the teeth, where a toothbrush is unable to reach. It can also help prevent bad breath by removing debris and food that has become trapped between the teeth. Although there is a lack of long-term studies proving that flossing is beneficial, the ADA continue to recommend it. The CDC trusted source also state that people should floss their teeth. Most dental health professionals recommend gently pushing the floss all the way down to the gum line before hitting the side of the tooth with up and down motions. It is important to avoid snapping the floss up and down between the teeth, which can cause pain and will not remove plaque as effectively. See a dentist regularly. A dentist can diagnose and treat oral health issues before they become severe. Experts recommend that people see a dentist every 6 months for a checkup. During a routine dental examination, a hygienist will clean the teeth and remove plaque and hardened tartar. The dentist will check for visual signs of cavities, gum disease, mouth cancer, and other oral health issues. They may sometimes also use dental x-rays to check for cavities. The results of a recent study confirmed that children and adolescents should see a dentist every 6 months to help prevent cavities. However, adults who practice good dental hygiene every day and have a low risk of oral health problems may be able to go less frequently. The authors of a recent review trusted source state that there is a need for more high-quality studies to confirm the ideal frequency of dental checkups. People can speak to their dentist about how often they need a checkup. The answer may vary depending on a person's health history, age, and overall dental health. However, anyone who notices changes in their mouth should visit a dentist. Do not smoke. Smoking harms the body's immune system, which makes it difficult for the body to heal tissues, including those in the mouth. The CDC names smoking as a risk factor for gum disease trusted source. while the ADA warned that people who smoke may experience slow healing after a dental procedure. Smoking also affects the appearance of the mouth, leading to yellowing of the teeth and tongue, and it can give breath a bad odor. Consider a mouthwash. Some studies indicate that certain mouthwashes can benefit oral health. For example, one review found that mouthwash containing chlorhexidine, an antibacterial ingredient, helps control plaque and gingivitis. Mouthwashes with certain essential oils are also effective, according to a meta-analysis. People may wish to ask their dentist which is the best mouthwash for their individual needs. A mouthwash cannot substitute brushing and flossing, but it can complement these practices. Limit sugary foods and starches. Consuming sugar can lead to cavities. Studies continue to highlight the significant role that sugar plays in adverse dental health outcomes. Common culprits include candy and desserts, but many processed foods also contain added sugar. The WHO recommend that people limit their intake of sugar to below 10% trusted source of their daily calories. The authors of a systematic review concluded that lowering this to 5% would further reduce the risk of cavities trusted source and other dental problems. Experts have also stated that starchy foods, such as crackers, bread, chips, and pasta, can cause tooth decay. Drink water instead of sugary drinks. Sugar-sweetened beverages are the #1 source of added sugar's trusted source in the typical diet of those in the U.S. Sipping on soda, juice, or other sugary drinks can lead to a higher risk of cavities. The ADA recommend drinking water or unsweetened tea throughout the day and only drinking sugar-sweetened drinks at mealtimes and in small volumes. Brush your teeth twice a day for 2 minutes each time. Keeping your teeth clean and healthy begins with regular maintenance. Brushing for 2 minutes at a time twice a day, known as the 2x2 rule, will help to keep plaque at bay. Patients with children should introduce this concept early and find ways to make it fun. You can play a song while they're brushing, or use a timer to know when 2 full minutes have passed. To make it easier to clean every tooth, try to spend 30 seconds on each quadrant of your mouth: upper right side, upper left side, lower right side, lower left side. Using the right techniques are important to ensure the teeth are being cleaned properly and you aren't damaging the soft tissue around them. Floss daily. It's recommended to floss every night before brushing to remove anything your toothbrush is unable to dislodge. Many patients admit to skipping this step, but it is an important part of a healthy routine. If you only brush and decide you don't need to floss, small particles of food and other deposits that are missed by your toothbrush can eventually develop into decay. To avoid this, make sure you take 2 minutes a day to add flossing to your routine. When you first start flossing, it may cause sensitive gums to hurt. This is natural and will stop once you've been flossing for a couple days. When flossing, make sure you slide it up and down along the whole tooth. Don't ignore tight spaces. This is one of the most important places to floss, as your toothbrush can't reach these areas. So guys, let me know your thoughts down in the comments section below. For more interesting content, give this video a thumbs up, and don't forget to subscribe to the channel for more awesome content. Have a nice day, and I will see you in the next video.